So the thing too is, remember, normal chest X-ray, there may be some pleural or fluid effusion, dilation of the pulmonary artery, okay, maybe because the clots are blocking blood flow into the lungs. And then if you look at the chest X-ray, there's no vascularity in that area. Okay. Now, let's take a look at it. Okay. We already said that it's a very common disease, kills a lot of people. There's a lot of people that may go undiagnosed. Okay. I unfortunately had one of my students bring in a CT scan on a 38-year-old patient that had a PE right in the main pulmonary artery, and the thing was going back and forth as the heart was pumping. And finally, when it went, it was dead. The patient died almost immediately. But the thing is, normally we're concerned about blood clots, and then, as we said before, broken bones can have fat emboli. Pregnant people can have amniotic fluid. You can also have other things in there like catheter fragments and stuff like that. Okay, so.
What about air?
Yeah, you can have air emboli too. It normally takes a lot of air to kill a person. I mean, you really gotta.
A liter and a half.
Yeah.
Right.
I don't know how much, but I know I've seen patients that have their whole right ventricle full of air.
What about if they have like a septal defect and it cross to the left side?
Yeah, cause some damage that way. But the main thing that you got to be concerned about is if you suspect that a patient has an air embolus, what should you do?
Well, there's.
Huh?
DQ.
DQ. Which one, right or left?
Air goes up, fluid goes down.
Okay, so right or left lateral DQ.
I didn't hear what side it was on, sorry.
It's an air embolus that somebody accidentally injected, so it's traveling on the venous side, coming into the superior vena cava.
Right side up then?
Yeah, so you do a left lateral decubitus. Usually left lateral decubitus is the best position for shock and also for air embolus. Okay, it makes it easier for the blood to drain in. Okay, so anyway, remember that most of the emboli come from the deep veins in the lower extremities. Over 50% of your emboli come from that area. So, okay, so, and basically anything that's floating around in your blood other than your red blood cells is considered an emboli. Okay. Now, the reason why it's very important, mainly there's not much you're going to be able to do about the clots that are already there. But whenever you have blood clots, over 80% of the time you have more than one. And if the patient is forming clots, you want to stop that. So that's why we give the patient anticoagulants. The anticoagulants are not going to do anything for the clots that are already there. So they will prevent more from forming. Normally your body has its own enzymes that it uses to break the clots down, and hopefully that can be, we can buy the person enough time for that to happen. Okay?
What kind of enzymes are supposed to be?
Oh, you have just these proteolytic enzymes in there that just, I mean, your body forms clots all the time. You know, anytime you get a bruise or anything like that, you have emboli.
Tissue, plasma,
Yeah. So your body will break them down, but it typically takes several hours. And normally, as they get smaller and smaller, eventually they get forced through the lungs, and they will wind up being picked up by your RE system in the liver, bone marrow, or spleen. Okay, we put down here that it's not a disease, but it is often a fatal complication for venous thrombosis. And normally I put down here it's microthrombi, so it's RBCs, platelets, and fibrin. Okay. And it says they are formed and lies within the venous system. Okay, so your body, like I said, takes care of most of them, provided you live long enough for the enzymes to work. So that's why we give the patient anticoagulants. And when these things come out, they're like glue. They'll start picking up more blood cells and start making the clot larger. I've seen some pretty large clots. This one that killed that 38-year-old patient was actually, probably about the size of a thumb. It was a big, I've actually got the X-ray too. I've got the CT scan. We did a CT scan on that one.
How did they get it?
Oh, the CT. Well,
The plot?
they didn't. Patient died.
Well, I mean, how did it happen?
Just they just lying around, surgery, things like that.
How long after the CT did they die, though?
Probably, I think about maybe 7-8 hours.
They didn't catch it on the CT?
Yeah, they caught it on CT, but it was in such a bad position they couldn't get it.
That sucks.
Yeah, I mean, just sitting there watching, they were hoping that it would, not
Break up or
go,
something.
but the thing is, break up, and the thing was that it didn't. So, like we said, what's the most common cause of death? Right now heart disease is back up to number 1 from what I saw. What's number 2?
Cancer.
Cancer. Okay, and then PE number 3, so.
Wow.
What? Yeah, that's, over 100,000 people a year, over 2 million people get them, 600,000 of them wind up in the hospital, and more than 100,000 of them die. I mean, we used to be doing these things almost, once or twice a night. Okay, but now I hate to say it, but we're losing a lot of our business to CT.
Is this caused by increasingly sedentary lifestyles?
Well, in the hospital, anytime you're lying around and not moving, you're prone to develop PE. Usually if you're not moving around by 3 days, you probably have pneumonia, just simply because the lungs aren't, working as hard as they should. So, and like I said, since they don't do as many autopsies as they used to, they're probably missing a lot more. I mean, that's what they're saying here. 75% or 70% of the cases are missed because they don't do autopsies anymore. Unless a person has been without a doctor's care for, I think it's like 30 days now, they won't do an autopsy. Okay. But this here, okay, so who gets it? Prolonged bed rest, or immobilization. So if you have a broken leg, or you have you're lying in bed for a week, okay, you got problems. What's that? Playing video games for, I heard
24 hours?
Some kid was playing video games and died of it. Okay, after surgery, bypass surgery, remember that they shut the body down, basically. They put the heart on a bypass machine, so all of that blood that's sitting around for a few hours while they're doing the open heart surgery, when they reconnect them back up, if they didn't give them enough anticoagulants, you're looking at a possible embolism. We said all pregnancies are at risk, and especially so pregnancy and after birth. Okay, remember the amniotic fluid. Older patients, because they have a sedentary lifestyle. Okay, and then the incidence is, the good thing about diversity is that everyone has an equal chance of dying from PE. Yes. Okay. Now, some of the stuff here. All of these good little things here. Okay. We've already talked about any of the diseases that slow down blood flow. If we're using catheters, congestive heart failure, you name your poison here on this one. The oral contraceptives, I think you guys probably have seen the commercials for any like hormone replacement therapy or contraception. The drug abuse people, those guys normally have all sorts of, their veins are pretty shot and they're injecting clumps. I've seen clumps of bacteria and stuff like that. Myocardial infarction or ischemia, anytime the heart stops or slows down. So all that's good stuff. Okay. Now, we talked about what could be the signs and symptoms. So this is what they call Burko's triad, the spitting up of blood. Normally that's because of a pulmonary infarct. So the blood clot's been there for a while. Difficulty breathing and chest pain. That's called Burko's triad. Who's Burkow anyway?
The guy who discovered the German another question.
See, that's what I love.